Well, welcome back, everyone. Dr. Jessica Abrantes-Figueiredo has a very clear picture of the suffering and loss that comes from COVID. She is a member of the state's COVID-19 Vaccine Advisory Group and Chief of Infectious Disease at St. Francis Hospital. Doctor, good morning. Thanks for taking the time to talk to us.
Morning, my pleasure.
You know, paint a picture for us. What is it like in the hospital right now in terms of the number of patients you're treating for COVID and their conditions?
Well, our numbers have been relatively steady, but we still have a great number of COVID-19 patients right now. So it looks, although it doesn't look as similar to the height of the pandemic early on, it's still sometimes frustrating and heartbreaking to see so many patients still needing to be admitted and treated for COVID-19.
Absolutely. And have you seen that vaccines are having some sort of impact on case counts?
I think it's still a little bit too soon to determine it's all related to the vaccine, but there is some, promising numbers that whether it's the hospitalizations or deaths, obviously across the state, that we've been able to vaccinate our long-term care facility residents who are so hard hit and obviously at risk for something as extreme as death. I think we are starting to see that. And as we continue to vaccinate more people, we hopefully will continue to see the numbers drop as well.
Yeah, let's hope for that. I know a lot of your medical professionals have gotten the vaccine. Is the fear factor reduced with them because they've gotten it?
I think in part, yes, we kind of can have a sigh of a little bit of comfort knowing that a lot of us have been vaccinated too. But what's so important for our colleagues, our healthcare workers, but also the community members to know is that even though we've been vaccinated, we're still taking all the precautions necessary for preventing infection or spread of infection. The vaccine has done, and we've seen the efficacy being, it will prevent symptomatic infection as well as severe disease, which is so important. The question still remains, though, is how well will it prevent asymptomatic infection?
That brings me to another question I want to ask you. Say you've gotten the vaccine or maybe you're about to get it. Doctors are saying, you have to still wear your mask, social distance, wash your hands. Talk a little more about why that's necessary.
Absolutely. So again, like I mentioned, the importance is that the vaccine can prevent symptomatic infection, which is typically easy to catch or easy to delineate, especially with the testing that we now have readily available. And then it also prevents severe disease. What the studies didn't really look at were asymptomatic infections. So for example, even though I'm vaccinated and I feel well, I may end up having asymptomatic infection. And the question is, how can I then prevent spreading that? And we don't know if asymptomatic infection can be stopped or the spread can be stopped. So that's why it's so important, especially as we continue to get more data on this, but also as we continue to try and vaccinate our community members across the country or across the state, across the country, so that we reach that herd immunity as well. That's so important.
Now, we've, of course, heard about several variants of COVID-19 around the world. One of them has been found in a handful of patients here in Connecticut. These mutated versions of COVID are said to spread more easily. Can you explain what that means? Because if we are washing our hands, keeping our distance, wearing masks, what makes this variant spread more easily?
So it is true that the concern is that this variant can spread, has easier transmissibility. But that being said, it's still very important for us to wear our masks, watch our distance, because those things will still work in preventing that spread of infection. There's been a lot of concern or question also related to the vaccine, and will it prevent even the variant? And it's suspected that yes, it will, although data is still continuing to be ongoing to make sure that it would be at the same level of efficacy that the trials also showed.
Now, doctor, looking ahead here, once we get everyone who wants to be vaccinated, is there any hint as to when or if people will need to get another round or of shots or another round of shots?
Sure. So I think the data is still out on that, so we won't necessarily know just yet. But that being said, it's important for people to understand that once we reach herd immunity, we'll have more information about the rates of infection, the rates of death, and what we can do about, the masking, the social distancing, and when those measures can be released, or I guess you can say lessened. So again, to be determined.
All right, Doctor, we thank you so much for your time. We truly appreciate it this morning.
Thanks so much.
So up next, keeping the anger seen in our nation's capital out of Connecticut's capital. Speaker of the Connecticut House, Matt Ritter, will join us next.